Okay, this PowerPoint consists of 5 questions regarding diabetes. With the questions, we'll read through the questions together and the options for the answers. Give you about 15 seconds to decide what answer you would pick, and then we'll go through the question again and look at why the choice is correct and the other choices are incorrect. So let's begin with question 1. A diabetic patient presents to the emergency room with slurred speech. The blood glucose is 360 milligrams per deciliter. What is the priority intervention by the nurse? Do we want to give a 30-gram carbohydrate snack? Administer regular insulin IV push? Initiate an IV infusion of 0.9 normal saline? Regular insulin given subcutaneously. What choice would you make? Okay, let's go back to the question, look at the answers. Let's go back to the stem. What do we know in the stem? A diabetic patient with slurred speech and the blood glucose is 360 milligrams per deciliter. That tells us that the patient is in DKA. Now we need to know what is the priority intervention for DKA. Give a 30-gram carbohydrate snack? Well, we can cross that off immediately because that's what we do for hypoglycemia, not DKA. Our blood glucose is too high. Administer regular insulin IV push? Yes, we do that for DKA. Initiate an IV infusion of 0.9 normal saline? Well, we also do that for DKA. Regular insulin given sub-Q? We do that later on after that blood glucose is under control. That's not one of our priority interventions. So now we have 2 priority interventions. What one do we pick? The regular insulin or the IV infusion? Let's go back and think about what happens when we give insulin. When we give insulin, glucose is pushed back into the cell. Remember what follows glucose? Water. So we've got the patient who's already dehydrated. So if we give that insulin, what's going to happen to their hydration status? So we don't want to give that insulin. That is not a priority. We have to make sure that they're hydrated first. So answer C is what we'd pick. We initiate an IV infusion of 0.9 sodium chloride. Question 2. A diabetic patient has undergone a cardiac catheterization. What physician order would the nurse question? Administer metformin before eating? Infuse the IV of 0.9 normal saline until completed? Obtain a blood glucose level? Resume diet as ordered. Okay, let's look at the stem of the question. The stem is asking us, what do we know about cardiac cath? Well, with a cardiac cath, we do know that the catheter is inserted through an artery, and that dye is injected to see what arteries are occluded. So, what physician order would the nurse question? So, what is an order that the nurse would not carry out? Administer metformin before eating? Let's look back at metformin. What do we know about metformin? Well, metformin should be given right before the meal. We also know that with metformin, it should be held anytime dye is administered because you can send the patient into renal failure. So we do know that we are not going to give it. So that is a possibility. Infuse the IV of 0.9 sodium chloride until completed. Well, we know that we need to flush that dye out and keep the kidneys functioning, so that is a realistic order. Yes, we would want to do that. Obtain a blood glucose level? Well, the patient is diabetic, has been off the floor. Yes, we would want to obtain a blood glucose level. Resume diet as ordered? The patient really has nothing going on. They just had the cardiac cath. So yes, they should be able to eat. So we would do that. So as we look at all the choices, A is the one that we would question. So we would not administer the metformin. Okay, let's go on to question 3. We have a 2-year-old. A 2-year-old is diagnosed as being diabetic. What should the nurse teach the parents? The toddler will need frequent injections. Make sure the toddler eats all of the meal. Toddler will require constant glucose monitoring. Temper tantrums can mimic hypoglycemia. Okay, let's go back to the answers and the STEM. What question is basically asking, what do we know about 2-year-olds and their developmental stages? So, the toddler will need frequent injections. Well, not really. The toddler may need an increase in the amount of insulin, but the number of injections will not necessarily change. Make sure the toddler eats all of the meal. If anyone knows a toddler, you know that the toddler's eating habits are very unpredictable. They may eat one day and not the next, or they may eat one meal and not the next meal. So that is not a realistic teaching for the parents. Toddler will require constant glucose monitoring. At first, the toddler will require frequent glucose monitoring, but it does not need to be constant. So you can X that off. So let's see if the last one is something that is the correct answer. Temper tantrums can mimic hypoglycemia. Very important to teach the parents, because hypoglycemia can lead a toddler into a diabetic coma, because they're very sensitive to those changes in blood glucose. So anytime the toddler has a temper tantrum, the parents may want to check the blood glucose to see what's going on. Okay, question 4. The nurse is educating a newly diagnosed teenager about the disease. What should the nurse focus on regarding the developmental age? Teenagers are very compliant with insulin. It is easy for them to follow the diabetic diet. Often will inform parents of issues with health. Live in the present and cannot see long term. As we look at the answers to question 4, what the question is asking is, we have a teenager who is diagnosed as diabetic, and we need to focus on the developmental age. Teenagers are very compliant with insulin. Well, we know for a fact that teenagers can use insulin as a threat with parents. I'm not going to take my insulin unless I can do this, and it's going to be all your fault. So that we know is not a focus. It is easy for them to follow the diabetic diet. Don't forget, the teenage years are the independent years, and the teenager likes to go out a lot. Just think of the fast food places that their friends like to go to and hang out. They like to party a lot. They like to go to their friends' houses. So it is not easy for them to follow the diabetic diet. That's where we have a lot of problems with teenagers. Often will inform parents of issues with health. Teenagers are very secretive and quiet. They get scared easily, they get worried easily, but they don't confide in their parents. They usually confide in other people. They live in the present and cannot see long term. And that is the correct answer, because that's the only one that makes sense at their developmental level, because they live in the here and now. You can tell them about the long-term consequences of non-compliance, and they can't even fathom that any of those things can happen, because they think they're indispensable. Nothing's going to happen to them. That's just the way teenagers live. Okay, question 5. A diabetic patient seen in the clinic is worried about the insulin expiring once opened. What should the nurse instruct the patient regarding the insulin? Pick all that apply. So this is a multiple. Insulin never expires. Insulin should be refrigerated prior to opening. Open insulin should be kept at room temperature. Insulin is good for 30 days once opened. Always check insulin for discoloration before using. Okay, let's look at the answers to question 5. We see a diabetic patient. We know that they're worried about the insulin. So the question is asking, what do you know about insulin? So what would we teach this patient? Insulin never expires. Well, why does it have an expiration date? we teach the patient that never use beyond the expiration date, because the longer it's expired, the less effective it is. Insulin should be refrigerated prior to opening. That is true. We should always refrigerate insulin prior to opening it, especially if it's going to be long term. A lot of people will stock up on the insulin and maybe give 3 or 4 vials, and then before they need them, and then we tell them keep them in the refrigerator. Open insulin should be kept at room temperature. That is true too. It should be kept out of the sunlight, and it should be kept out of freezers. So open insulin, you just keep it in a dark place at room temperature. Insulin is good for 30 days once opened. We know that that is true. That's why we tell them to mark the bottle with the opening date. Always check insulin for discoloration before using. That is also true, because if it's discolored, that means that there's something wrong with it and they should not use it. So when we look at this, B, C, D, and E are all correct answers. Now go back. How did you do? How did you do on this quiz to kind of look at what you know about diabetes?